This is a reminder, we are being recorded, so by being present, you are giving consent to it. Thank you.
Good evening, everyone. I'd like to call the Tuesday, November. Oh, gosh, darn, I looked at the wrong paper. Sorry about that. I've got my minutes here. December 13th, meeting of Macon County Board of Health at 5:35. So Susan, if you can call the roll call.
Mark Scranton.
Here.
Jeff Entler.
Here.
Candy Clevenger. Here. Carolyn Wagner.
Here.
Jan Hack. Debbie Hill.
Here.
Dr. Jerger. Dr. Minigati. Cody Parks.
Here.
Dr. Smith.
We have enough for a quorum.
6 exactly.
Okay, everybody, please rise to join the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I need a motion to approve the agenda topics.
I make that motion.
Second.
Which one second?
Candy.
Candy. Mark Scranton.
Yes.
Jeff Entler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Debbie Hill.
Yeah.
Cody Parks.
Yes. Okay, we have a public comment, Randy?
No.
Okay, approval of previous meeting minutes. We have the Board of Health Personnel meeting, October 17th. The Board of Health Personnel Committee minutes from closed session from October 17th. Board of Health meeting minutes from October 18th. Board of Health meeting minutes from closed session from October 18th. Special meeting for Personnel Committee on November 1st. And Personnel Committee meeting minutes closed session on November 1st. Mr. Bagley, to approve all these jointly, or do we need to separate the closed session?
No, Mr. President, unless any member wants to vote on any particular set of minutes independently or all of them independently, if it's the unanimous consent of the board, then you can vote to approve these en masse.
I would make a motion to approve these as presented en masse.
I second. Mark, there was one amendment requested that Candy was present on November 1st.
Okay, you know that. Okay,
Mark Scranton.
yes.
Jeff Entler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Debbie Hill.
Yes.
Cody Parks.
Yes.
Okay, review and approval of Board of Health bylaws. I think the last time we had left this off, we had bylaws, and I think I had some personnel files. I think Mike was going to be taking a look at some things.
I have submitted a suggested or a set of revisions to the bylaws that was done back in October, and I think I forwarded those onto the bylaws committee. I don't know if the bylaws committee has met and reviewed those.
I don't believe so, because we didn't have a meeting last month.
I got no update from them.
Okay, all right. So we'll table that. I want to get that done next month, though, so make a note, we want to get that cleaned up. Okay. Same thing with personnel manual. We don't have anything. Changes from not from the personnel committee anyway. Okay, moving on to discussion action regarding position vacancies and related policies. So just to kind of bring the rest of the board up to speed, since that's half the people that are now in the room. The personnel committee met tonight to discuss potential ideas that we are looking at in ways to provide some retention and appreciation at the same time of staff. And so we had a discussion of that for a personnel meeting. And I'll let Carolyn kind of go over that a little bit for the good of the cause, to tell everybody else what we had discussed in the meeting previously to tonight.
You want me to go ahead?
Yeah,
Okay.
go ahead.
So during our personnel committee, we were talking about retention and recruitment and ways that we might be able to help as a board with that. I'm currently going through the exit interviews from 2019, 20, 21, and 22. We're looking at the number of employees who have left, and I'm looking at the reasons why they left, and it's a myriad of reasons. But coming out of this, we thought about what could we do to maybe help the staff realize how much we appreciate that they remain in their jobs, and we reward them for their years of service. So what we came up with this evening in our discussion was a longevity bonus idea that would be based on years of service from at 5-year Hallmark, 10-year Hallmark, 15, 20, 25, 30-year Hallmark. And during those years of Hallmark, those Hallmark years, that person would receive $200 per year of service. So if I was going to reach my 5-year anniversary in 2023, the proposal would be that I would be given a $1,000 bonus. If I were going to hit my 25th year of service, I would get a $5,000 bonus. But it's a one-time per year. So it's possible if you started here and you worked all the way up through 30 years, we'll all be gone by then, but if that were put into place, you would end up getting your bonus at each of those Hallmark years. We also discussed, what about giving every employee as a start to kick off the program a one-time monetary gift of appreciation? Because if I hit my 5-year, 2 or 3 years back, you know.
Or 2 months ago.
Or 2 months ago, we're trying to just be as fair as we can. So that's what we're at and where we're discussing. We also brought up some other ideas that we're still thinking about, but this is the most concrete one that we would like to see get started in calendar year 2023. Did I capture everything?
Yeah,
Okay,
I would say so.
okay.
And the whole point of doing this is, as we talk about, you know, the challenges with retention and, you know, use that as a tool for incentive for recruitment. Another thing that we brought up, Carolyn talked about this piece of the puzzle, so to speak. I had brought up looking at some potential options about what we might do to provide some limited funding to support staff that has some skin in the game. They've been here for a while and they might aspire to want to increase their growth in their job. They might be working as a clerk. They say, hey, I'd like to go work in Kathy's department, for example, but I don't have the credentials for it, you know, but I could go out to Richland and take some part-time classes or something I could do online, but my roadblock is I can't afford to do it. So we want to look at some things, how we might take, you know, some money and set it aside for some programs to incentivize employees to try to grow, you know, in their career if they decide to do this long term with the health department, to give them the knowledge that we have something here that we can do to help invest in them as part of the mechanism to keep them to stay on board with working here. We obviously can't fund a 4-year college for anybody, but for some classes they might be able to take, you know, maybe it's just going to some trainings or something, a seminar that helps out some continuing ed credits or something like that, some online classes. I mean, it's just a discussion that we had tonight, and we're going to pursue that going forward, because I think that would be a good investment in our people, because if they know that this is not a job that just this is it. This is all I can ever be working here. I have no future here. This is just a stepping stone for me to leave here and go off somewhere else. Now they can see that, hey, there's some opportunities for me here. I can go talk to somebody and say, I'd really like to do this. What do I need to do to be able to get to that position? And then they can decide it's a good fit for them financially or just career-wise or whatever. So we're just doing some out loud thinking at this point on that, trying to think outside the box, so to speak, because a lot of people are getting pretty creative about how they're recruiting people. I brought an idea up that I've done at work, and I've had probably in the last 6 months, I've actually had 2 people follow through. I told employees, you get somebody you refer to come in, they have to work a minimum 90 days, and you get a $500 bonus. So I don't want people referring people to come to work if they're not going to be around, but I want them to bring people that they feel like they would be a good part of the business. So, I mean, we can look at some things like that as well. A lot of companies are getting really creative thinking about, I mean, I saw a billboard the other day. One company's giving $50 a week gas cards away just to get people to drive out of town. They're leaving Decatur and they're leaving Macon County to go work outside of here. They're not talking about health fields specifically, I'm talking about jobs in general. So there are some companies doing some creative things like that. And for a lot of us, they may not sound like a lot, but for somebody that's willing to drive 25, 40, 50 miles each way, you know, $50 a week, you know, just for gas, you know, it's not a lot, but it helps. And so just think out loud. If you guys got some ideas, let us know. I mean, we can talk about it now or down the road, but we're trying to do some creative thinking about what we can do to keep our people here longer and help lift them up and motivate them a little bit more. So that's kind of where we're at with that. So I don't know if anybody else has any thoughts on that at all. I know Dr. Smith just came in, so we're talking about doing something with anniversaries. People hit their benchmarks in 5-year increments, giving them something to recognize their years of service. So we're talking about some different dollar amounts we might do for that to promote some longevity, staying in the department for a little bit longer. So that's something we think might be beneficial. So if you got any more thoughts on that or whatever, feel free to let us know, because I think it's something that the personnel committee, the 4 of us, we talked about, and we think it's something I think we'd like to move forward with going into next year to kind of get things going. I think it'd be a good place to start going new year.
That would be great.
We got some other stuff kind of behind us now, so we could kind of start moving things forward with a new direction, new focus. I think it'd be great.
I can talk to the hospital too, because I know that they don't pay for everybody's tuition, but they do kind of support them in that financially if they're wanting to, you know, get a higher degree, and that usually requires them to commit somewhat to, you know, for a certain period of time to the hospital, but I don't think they outright pay for all of your tuition, but
Right.
I think they will help you, and I'll talk to Human Resources.
Yeah, that'd be great. I mean, we're not talking about paying for something, like somebody wanted to go to Richland because they want to get an associate's degree. Maybe they're a clerk and they go to Richland and say, I'd like to become, you know, a CNA or want to become an LPN or whatever. What could I do? What are the steps I need to take, even if it's just basic classes? Because most of your college courses, you got basic classes you have to take no matter what. So even if it's just a little bit of, you know, assistance to help get them moving in that direction. And if they're committed to doing that and they maintain, you know, good relationships in their job and they get good grades, I mean, I think have to be some stipulations in there to tie together all that. And we can get more into the details of that going forward. But I think doing something like this could be really beneficial.
My experience with it is we do a flat amount and they have to complete the course.
Yeah.
So, and it's so much per year. And so everyone had the opportunity to get that much per year, but really not that necessarily much advantage of it. Not everybody was going to school. So you're right, sometimes it feels like you're taking a class that doesn't really get you, but if you're trying to get a 2 degrees, you can move on to a bachelor's degree, but you can take all those recipes.
I think ADM does carry a certain degree average to get a certain amount, or, you know, to get paid.
Yeah, I think you'd have to have a certain GPA. I mean, you'd have to, I mean, because you could pass a class,
Yeah.
and still not have the knowledge from that class, you know, as it relates to what you might have to, you know, have that knowledge, you know, in your job, career-wise. So, but we're just doing some outside the box thinking, so appreciate, and even supervisors, 2 of you are in here now, I guess that's all it's here, but,
3.
okay, let's hide around the corner. But I mean, if you guys got some thoughts on this, what you see within your own departments, if you say, hey, I think if we did this for my people specifically, I could see where this could be a real plus. So we'd
I
like to hear
did
from you too.
receive something like that when I worked at St. Mary's. It was $2,500. It was when I was getting my bachelor's, going from an associate's degree RN to a bachelor's. I had to turn in my grades every semester. I had to maintain a 3.6. And it was like a flat 2,500, but you also had to sign on for 2 years to get it. I mean, and this was several years ago. I don't know if that's the same now. I think the 5 and plus increment is great. Our problem is getting them in the door for 5 years, especially nurses. We're desperate for nurses, in my department at least.
But we have some people that are already in that queue already in different areas based on the time they've worked here. So I recognize those people that are here now, and hopefully that'll help bring everybody else along down the road. They can look at that as, this is another thing I could look forward to.
I know I did see that Memorial was advertising for a brand new, and we couldn't touch this, but it just shows how hard it is to get people for a brand new RN grad residency. So that's someone who's never been a nurse anywhere before. They were offering $15,000 sign-on bonus.
Wow.
So
And we can't compete.
that, right.
Yeah.
I know in surgery alone, they have 12 positions right now for nurses that are unfilled.
We good, Mark, yeah.
It's
warm in there.
I don't know, what's the pulse of the board in regards to doing this? Is this something you guys want to talk about a little bit further and think about it, or do you want to vote on this now? I mean, we have the ability to take a vote on it if we want to.
I'm ready to vote on it. I think it's the budget pretty minimally, and it's a good.
Yeah, I mean, we ran, just so you guys know, we ran the numbers on it, and the cost to do this based on the people that are currently eligible that fall in that category. It's not a tremendous amount money wise, so we don't have, the 4 of us didn't have a problem with it. So I don't know, it's whatever the wishes of the board, you know, are to do it. So do we need to get specifics about what we're going to do, or just what the plan is going to be?
I would probably rely on Mike to tell us that, but we'll definitely need specifics before we can do anything.
I mean, if the motion is stated in concrete enough terms, or if you feel like you've already stated it in concrete enough terms that it's reflected in the minutes and the board members are clear on what they're voting on, then you can do this now. My alternative suggestion would be to reduce it to writing and vote on it either at next month's meeting, or if you think you can do that tonight, you know, certainly you can have staff draw this up with the details that you outlined, but you're capable, you certainly have the ability to adopt this tonight as you described it, but you'd be relying on the minutes to accurately reflect that, and you want to make sure that all 7 of your members understand exactly what they're voting on when they vote. The better practice is typically to have it very formalized on paper before voting.
Yeah, and that's kind of where I was leaning, that's why I want to get your advice. I would prefer that we get this in a more structured writing with more details in it. And not only that, we've got 5 of our board members not here, and I appreciate them being involved in making a vote on something significant as this. You know, it'd be great to have them here, and I know not everybody's gonna make every board meeting, but I think the fact that we've got somewhat of a consensus to move forward with this, I think I'll ask Carolyn to work on this in a little bit more detail and provide that to Brandy and Bethany.
Okay.
And then we can put this into an action item for next month with more specifics into as far as the dollar amount and what the terms of this would look like and that type of thing. I think we just kind of walk this along, and that way we could vote on it. It could take effect next month. I think from a timing standpoint, I think that would be sufficient.
One thing I didn't think about earlier would be like an effective date for all employees as of this date, or what that looks like. Because
And that-
people are constantly, coming or going, so.
And that's what, I'm gonna charge Karen with that responsibility on behalf of the board, the personnel committee, to kind of work those details out and share that with everybody else. Between you and her, we can kind of work the details out. And if anybody's got a real problem with it, we can send it out in advance of next month's meeting. So say this is the draft or what this is gonna look like, if it's got concerns or questions or wants to make some changes, or where we can get that conversation to the point where we get to the meeting next month, then we have all that terminology in place and the date that this will be effective and what it would retroactive, if that was the case, go back on that. I think that we've got some time to digest it. I think I'd feel a lot better about that.
So you're saying if it was my 5-year anniversary, I missed it, you guys adopted this next month, I just have my 5-year anniversary right now. Are you guys gonna back it up any, or are you just saying no?
This wasn't gonna start until 2023.
Yeah.
So, yes.
So when it does start though?
If you had it in December of 2022, yes.
Yeah.
And that's why we were wanting to do a separate
One
one
time,
time.
Yeah, I'm with you, I understand that.
Yeah,
Yeah, I just didn't know if you was gonna do like, some of them
We
say,
felt that
if
that
it was
was,
within 30 or 45 days of that date, if you,
we were just.
we felt that would be a good way to address
Yeah.
all the concerns of that. That way it gets everybody on a level playing field going forward into next year. So we got actually 2 separate proposals that we're gonna present. And I think that makes it satisfactory to everybody. And I think that's a good way to start it out. Okay, anything else on that? Okay, review, discussion, and action of flex time pay policy. I don't think anybody's prepared to have any discussion on that tonight. Jeff, you got anything you want to visit on that tonight? So we'll put that up till next month. So we have an update from Popeyes here tonight.
Good evening.
Good evening.
If you would be so kind as to tell us your name and your position.
Yes, my name is Mir Ali. I'm the Vice President of Operations for Popeyes. And it's a pleasure to be here again. I know I was here a few months ago, so I'm here again just to provide a quick update on where we stand with the Decatur Popeyes. Plans have, I believe, just been submitted into the city for approval. I did send a copy over to Kathy so she can share that with you. A couple of things that I do want to point out that we've seen some significant progress in our operations in the central Illinois area, which I alluded to last time when I was here. So we did, we got out of the trench that we were in with a few of the health departments. I do remember Mr. President pulled out about 15, 16 pages last time when I was here. And that, well, there's a, trend, if you will, with health department issues. So I'm very proud to say that, Sangamon County, they've lifted all restrictions of high risk off our stores in Springfield. In Peoria, we were able to open up our Knoxville store, which was closed by the health department maybe early this year, I believe in January. And it just reopened today, as a matter of fact, that's where I'm coming from. For Decatur, the building's gonna look brand new. I shared some renderings with you guys with the board last time I was here, so we're still sticking to the same plan. All the equipment is being replaced. The location was already deep cleaned. I know Kathy visited it last time, I think you were there, right? Maybe a couple months ago. And I personally did visit that location as well. We threw away basically everything that was in there. With that being said, all the equipment plan, the plumbing plan, sanitation plan, all of that Kathy should have in her possession. And we have a new director of operations that we also brought in. Last time I came in with Mr. Nick Freeman. Nick is no longer with, he's no longer with Central Market. He's back in Arkansas. We brought Tasha Austin, who's been with us for about 16, 17 years, I want to say. Very sharp young lady. She's going to be managing this market, Central Illinois, which is about a dozen stores. Danville, Champaign, Springfield, here Decatur, Peoria, Bloomington, and so forth. Tasha brings a wealth of experience, and she's actually been the driving force, behind all the good things that have been happening in the Central Illinois market. The managers for the store, we have a couple that we're still looking at who we're gonna bring in. I may be pulling somebody from Bloomington or Peoria, a little bit more seasoned. The drive, yes, it's an issue. That's something that we're dealing with right now. But the crew in its entirety, we're bringing our training department in to train everybody. Once we have kind of like a timeline to see when the project will start, when it will be ready. Normally, we start training about 45 days out. We'll start hiring about 60 days out. And we really want to support the community. We want to give back to the community. We want to be a part of the community. I think it's very, very important that we start off on the right foot, given the history. And we don't want to see ourselves on any Facebook page. Just, good and likes and, so forth, good things. So yes, we've, like I mentioned before, we've invested about $500,000 into this building. It's not gonna look anything like what it looks right now. It's gonna be our new 2112 model. Everything's gonna be redone. The dining room, the bathrooms, the back of the house, new POS systems. Everybody in the store, all the managers that will be running shifts will be ServSafe certified. And they'll be going through our Popeyes Academy, which is also about a 60-hour course, for any team members, which is also an enhanced food safety training as such. All that stuff will be taken care of before we even open our doors. We'd like to have a friends and family night once we open, so you guys are more than welcome to come and try some of our wonderful sandwiches that we have, or chicken. But in a nutshell, that's what I have. Just wanted to say hello again. And yes, ma'am.
I have a question. You said that everything in the store will be new, including the equipment.
Equipment,
That
yes.
means the walk-in cooler?
Yes, because once we sanitize, deep clean the entire store, we threw 90% of the stuff away because just the way it was. We're not going to take any chances from the pop machines, to the POS systems even. Those little critters, all the cockroaches love to get in there, and we did not want to take any risks. That's one of the reasons why it was a high budget remodel for us, because the store being closed for that long of time, we don't want to take any risks with any of the equipment. So yes, I personally went to that store once it was deep cleaned and sanitized, but there was some type of smell coming from that walk-in cooler. I said, no, it's not going away, get rid of it. So yeah, it's the walk-in cooler and freezer, we've already gotten that work.
Good. Okay.
So what's your timeline you feel like you're headed towards?
We're at the mercy of the city of Decatur.
Barring that.
Yes, well, once the plans get approved, which I think we've been working very closely with the city in that regard. So I trust as soon as we get the plans in, the holiday season, within probably about 30 to 45, 60 days, we'll have final plans in place. And then it takes about maybe 3 months or so to get, so I'm still looking, we're looking at probably late spring, early summer, I want to say, to open up, which is a great time to open. I really don't like opening in the winter time, so yes, ma'am.
You had originally told us that Decatur was going to be the training hub,
Yes,
and then we heard that Springfield was going to be the training hub. Is there any truth to that rumor, or?
No.
Okay. So Decatur is.
A new store is going to be a certified training store.
Okay,
It's a lot easier for us to get a brand new store, which has, everything looks perfect. So they don't have any maintenance issues, if you will, because a brand has to certify that store. That store has to meet certain metrics. And, the Springfield stores, yes, they're operating very well now. But they are older stores, and the look and feel, we want, Decatur to be a training store. This one and possibly Knoxville as well, since they're, quite a ways apart, an hour and a half or so.
Okay, anybody got any other questions? Okay, thank you.
Thank you. Thanks
Appreciate
for
you
having
coming
me.
in.
Thank you.
Thank you very much.
thank you.
Okay, review of the holiday dinner. So in the packet, the cards around there, we got a nice little thank you from the members of staff. For those that weren't able to make it, I think it was a really good, I think it was a really good time. Had a lot of positive feedback from everybody that was there. I think the venue worked out really nice, which was my personal hope. Carolyn did a magnificent job on decorating because that's definitely not my wheelhouse. Y'all would have got Twinkies and a Christmas tree on the table or something probably if I would have did it. So, but we had great food provided by some of our members in the community, putting everything together. And I think everybody really enjoyed themselves, and appreciate the fact that we did get a good response from the staff to attend it, because it was something, new. We wanted to try it out and see how the response was, and I'd like to have seen a better turnout, but I understand that getting the holidays and schedules, it's never going to be an ideal situation to get everybody to go to an event because of just the timing issue and that kind of thing. But that being said, I want to share with the rest of the board and with the staff as well. So because we did have an overwhelming amount of people that would like to have had some type of a family event also, besides it being an adults only event, I'm excited that we have our projection screen and projector online at the Lincoln Theater now. So I told Brandon we have plans to probably sometime over the winter after we get through the holidays and everybody's kind of down and out and want something fun to do. I want to throw a family fun night on a Saturday afternoon or Sunday afternoon, something like that. And we'll have some free movies so the health department staff can bring their kids in, and we'll come up with some fun stuff for that around the movie or two, and make it more of a family affair. And I think that would be great, for the people working here, and still something I'm excited about being able to do that. So I think what we did this year was a good start. I think all of us that were there thought it went really well from the board perspective, and I appreciate those that were able to show up, and hopefully the next time we do this again, we'll be able to get a better turnout. I'd like to see us do a few more of these maybe over the course of the year. I could see us maybe doing some type of a summertime cookout, something like that, area parks or something, and have a event where we can bring Mr. Softy truck in, because I like ice cream, so that's important to have Mr. Softy show up. You can never go wrong with that. So I think it'd be good if we do this, because I think it would be a great thing for the employees, because I do it for my business. I have a thing once a year for my customers around the holidays where we just do a big luncheon, and it's not a lot, but people really, really do enjoy it. It gets them a chance to get away from work for a little while. So I think that's something that we'll talk at greater lengths about, some ideas down the road. But I think this was a good place to start, and I appreciate everybody's involvement in helping make it possible. So, and Brandy, thanks for getting staff to come, and I was really pleased that everybody enjoyed themselves. It was I think it was a great night.
Thank you to all of the board members for doing that. I think it was a nice extra special treat. I know there were some staff that were unavailable and wish they could have come, so hopefully they'll be able to make it next time. So thank you again.
Absolutely. Okay, new business. We have several resolutions to approve. Yeah. First page is on the back of the thank you card. So we have Macon County Board Resolution approving increased appropriations for FY23 Health Fund budget for pre-exposure prophylaxis. Did I get that right?
Yeah.
Gosh, I did get that. So if you wouldn't mind explaining this in a little bit more detail, Brandy?
Yeah, I will actually have Rachel explain it, because she has a little bit more detail than I can.
Sure, so this is a PrEP grant that we were awarded $15,000 from the state to help with our HIV prevention program. So this money will be really great to help us staff our STI clinic, if we get the nurses to staff it with, so that we can bring patients in to get them on medication to prevent them from getting HIV.
Okay, make a motion to approve the resolution as presented.
Second.
I make that motion or second it, whichever you need.
Okay, I'm gonna say motion by Dr. Jerger, seconded by Carol.
Perfect.
Mark Scranton,
Yes.
Jeff Etler, Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Macon County Board resolution approving increase in appropriations for FY 23 health fund budget for emergency preparedness coordinator. This is to, okay, Kathy's back. I'll let you talk about this then.
What?
We're talking about the resolution to approve the additional funding for emergency preparedness coordinator.
Oh, so this was, in my terms, simple terms, basically removing all of the environmental health requirements for that emergency prep coordinator, making the emergency prep coordinator a full-time position, being able to bring back programs like CERT, do a lot more training with our staff, because with the turnover, we're, these individuals haven't participated in drills. We don't know how to use radios. Don't tell them. I wasn't pointing a finger, but we're learning that there's definitely a lot of areas that we need room for improvement on. And when you're trying to kind of juggle both programs, it's a little difficult to spend that much time on one program without letting one program slide, and then you try and make it up and it goes back and forth. So this is basically making it a full-time position and being able to possibly bring back some programs that we've recently had, but we no longer have.
I'm gonna make a motion to approve this.
Motion to approve.
Second.
Second, Jeff.
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Macon County Board resolution approving increase in appropriations in FY 23 health fund budget.
Grant. So, big thanks to our team for the work on the application. This just basically is a resolution to reflect that, and then the expenses are already included in the FY 23 budget that you approved. This will cover the cost of cloud-based dental software, and then of course staffing.
Motion to approve.
Second.
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Macon County Board resolution authorizing disposal of surplus property by the Macon County Health Department.
This is just one that basically we have to go through certain steps with a resolution and then take it to our oversight committee and the full county board to get permission if we are disposing of items. We, with the guidance of Mike Baggett, have taken on the practice the last few years of when we have several things that need to be gotten rid of, that we do a resolution. We have put this on our yearly calendar to do it at least once a year to ensure that then we are allowed to get rid of things that are, you see like an example of items that are broken, no longer functioning at all, are very obsolete. So just permission to dispose of those.
What is the manner with which it's done? Are they just tossed in a dumpster, or are they put out for sale to the public, or what's the process?
So it depends on what the item is usually. If it is something that still works, let's say there's a desk that for some reason we can't use, just as an example, we would first send that out to the other county departments to see if anybody wants that, and then it is given to them. If it's something that doesn't work, it would be disposed of. The building commission helps with that, throw it away. If it is an electronic item that has to be discarded of in a different way, then we would obviously follow those rules as well. Thankfully, the building commission helps us with a lot of that. We do not put it up for sale. We do not give it to staff or sell it to staff.
Okay. All right.
Motion to approve.
Yeah, I'll second it.
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
Macon County Board resolution approving increase in appropriations in FY 22 and 23 health fund budget for mass vaccination grant cleanup.
This is just pretty much making sure that the mass vaccination grant funding is reflected in FY 22 and FY 23 appropriately. There's only 1 month of it in FY 23. So yeah, any questions you have, I'm happy to answer.
Okay, need a motion to approve?
Make a motion to go.
I'll second.
Mark Strand,
Yes.
Jeff Miller,
Yes.
Andy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Gerger,
Yes.
Cody Parks,
Yes.
Jeffrey Smith.
Yes.
Discussion action regarding the Board of Health vacancy. We received a letter, which I don't believe is in the packet, but Dr. Schneider had sent myself and Brandy an email earlier this week notifying us, or last week, sorry, that he was no longer going to be able to serve on the board in capacity due to some changes in his living situation, I believe.
I don't know, you just said
Yeah,
unforeseen
yes,
circumstances.
So we will now have a vacancy on the board. I know that we had a previous list of some potential candidates for board vacancies that we looked at the last time when Dr. Schneider was added on board, and I don't know who all we had, if anybody remembers. I know we had one or two, and if anybody's got any suggestions or recommendations, I know this kind of comes out of the blue, but if anybody's got some thoughts on some names of somebody they think might be a good addition to the board, then by all means, put their names
Does it
forward.
have to be a doctor?
No, we're okay with our ratio on doctors right now.
Do have a good doctor to put forward.
Okay.
Terry Bologna, who used to be the director of the ER. Great guy. I think he would do it. I'll talk to him.
Okay, appreciate that. Get back with us, let us know.
I would like to, maybe, Marcy Rue.
She's still in county board, isn't she?
No.
Oh, she's not now, okay.
I'll ask her.
Okay.
Okay.
Let us know.
She just
We'd like to
need
get some
thought.
names to the chairman. I'd like to get this filled maybe next month with the holidays and stuff. If it doesn't happen, then, another month down the road, get time to be able to follow with people, because it may be hard to connect right now over the next couple of weeks.
Jeff knows her. I think she'd be great. That
She'd
one,
be a good candidate.
she's a good asset to anything she does. She's great.
You guys have any,
Like we got a pretty good list.
you guys, anybody else in mind?
I just, I'm with you. I remember we had a pretty good short list left when we looked before. It's a while behind, and looking at that, and then.
Do you know anything about Dr. Minigati?
As far as I know, nothing's changed with his situation. I mean,
I haven't been notified of any change.
yeah,
I've spoken with him in length a few weeks ago, and he's gonna maintain his residency in Macon County. He's working at Sarah Bush part-time and doesn't have any plans to.
Wants to remain on the board.
It absolutely does. He started out by saying that he was gonna maintain his residency in Macon County and he wanted to stay, and that he has no plans to move at present.
so if Debbie, you would talk to Marcy and Dr. Smith, if you'd talk to the other doctor and try to get something formal in writing, expressing their interest.
Position or two?
There's just one,
Okay.
as of right now, yeah. Their interest. Brandy's actually got a form that we can get to you guys to have filled out that's a little bit more detailed in terms of giving the information that we're looking for. If you would, email that to them. Just email that form to everybody, and that way we've all got it, and that way if we have Anita Rice, we've got it. Okay, discussion approval of Board of Health email addresses on the website.
So basically, we just need to know from the board, do you want your email addresses on our website? There have been, people asking what your contact email is. It's not posted right now, and I just wanted you to be able to make that call rather than making it for you. So that's all.
You mean our official Board of Health, not our personal?
No, your official Board of Health, yes.
I have no problem with it, I just want mine to work.
Is it not working?
No,
Have you
I've
let
had
Evan
nothing
Luke
but
know?
trouble with it.
Have you let Evan and Luke know?
Well, I haven't had the chance to because there's a ton of meetings over. Yeah, that is, and I know there's a couple other people that brought that up too, that they've had issues. I don't think anybody else currently has an issue with it. Debbie does.
Debbie does.
Debbie always said.
So that's something I would want done before, because the last thing I want is people start emailing and say, well, you don't respond to my email I sent. I don't want to have that, so let's work on that
So wait
towards
on that for
next
now.
month, yeah, to get that stuff ironed out, hopefully. Okay, Board of Education Communicable Diseases update.
Okay, I just have a few things under this. First would be, and I did let Mark know, but I wanted to make sure the rest of the board knew, if you have anything that you want to add to the agenda for the January or February meetings, those packets will have to go out early because of holidays that line up in that time frame. So just a heads up for that. The thank you card. Another thing, just COVID update. I know I've been asked about that. You probably all have seen, we've got some numbers going up of respiratory illnesses, a lot of influenza, creeping up trends with COVID, some creeping up hospitalizations. You probably already know that, but I just wanted to touch on that. And we have moved into medium community level, which is the number or the level that people can use in the community to make decisions if they want to take some kind of prevention measures. And then high community transmission, that is the number for the healthcare facilities. Another thing I wanted to touch on was security. Just wanted to give a thanks again to the board for supporting us having security here. I do continue to think that that is important and appreciated by the staff. And I don't know that this is something you'd want to know, but in case you hear about it around the way, I'd rather tell you now. But we did have somebody put jacks out on one of our vehicles. They were noticed Friday night. One of our staff did remove them, take them home, and then the gate was locked, and a new set of jacks was placed sometime between Friday evening and Saturday at 3 o'clock.
Jacks.
To jack the vehicle up.
Oh, okay. Yeah, Jacks. I like.
Yeah, sorry.
I had no idea.
Jacks, yeah. I knew something was going on, yeah, and our staff did notice a couple weeks ago or so that there was a hole cut in our fence over there, this gated, locked area. So that had been patched, that patch is still in place,
Is there
so.
good lights over there?
We actually we have a list of things we're talking to the building commission about tomorrow at our monthly meeting to ask if they can kind of increase the measures that are being taken over there. And they've always been really open to helping us with those kinds of things, so I think that they will, and that's
So
one of the things we have down is lights.
Lights, even they got lights, we just doubled our size of lights in our shop, and it made a football field difference.
Oh, wow.
So
I'm
it's
hoping
kind
that
of
will
conversion
help.
expensive, that's
Yes,
why I'm
that's
trying to.
Do we have any external cameras in that area at all?
We do, and all that was picked up on those was some car activity. There was no, ability to see any people or really get any specifics. But that's what they were trying to do. The tools were even left when County Highway came over and the jacks were left on it. So I would assume someone was planning to come back. So we're going to work with Building Commission to see what else we can do to keep that area kind of off, limits and off the radar of people trying to.
So they were trying to take the tires?
Converters,
Yeah,
probably.
Yeah, they had it cut. They almost had it out of
You
there.
go to Springfield, a lot of their lots, you look at their empty lots or where they park cars, they'll have a pole somewhere. On top of that pole, they have a little blue light that,
Mhm.
and it has a probably dummy camera, but that light catches a lot of attention. People see them lights, and they don't think about cameras till they see that light flashing. That flashing light deters a lot of people.
Something motion related?
It just flashes all the time.
Oh,
It's just a beacon, it's a blue light, and people see that, and they see that camera, and right underneath there's a camera, they detours, it helps.
Well, we have a list, but if anybody has any other suggestions, please let me know, or you can shoot me a text or email or call me and I'll add those to the list, but I'm sure they'll be very.
have you had a conversation with the sheriff's department about this issue?
We call DPD.
Did you?
Yeah, to place a report, so.
So that's what's back there?
It's over here on the east side of the building
I've
across
noticed.
from Lober. There's a shed in there and then several vehicles and it's open during the day.
Your
We still have the vehicles out, yes, to help them in our vehicles, yeah.
Two pit bulls, maybe, and Doberman.
So hopefully we'll get some improvement there and they'll leave that alone. We did, I can't remember the date, but sometime in 20 or 21, somebody got in there and vandalized several of our vehicles. So hopefully we can do something to get that more protected. Another thing I wanted to let you know, and hopefully I don't say this wrong, so Mike, please feel free to jump in, but was at the last county board meeting, and there was some discussion about possible changes with the way the committees are structured. As of right now, I go to the EHW meeting, that's an oversight committee of ours, and give reports. We have to put the resolutions through that particular committee. So I don't know exactly how it's gonna change. I don't even know if Mike knows yet, but I just wanted to give you a heads up because it might change the date that we go or what meeting we go to. So I'll keep you posted, but I just wanted to give you a heads up in case you hear about that. Is there anything you want to add, or did I say any of that incorrectly?
Nothing is incorrect.
Okay.
I don't want to step out too far on that ledge because nothing has been really formalized or decided, but I suspect there will still be an oversight committee, whether it be named EHW or something close to it. It may stay the same. And then there is an open question as to how the process will work, if there's still going to be a need to go to both EHW and finance. But that may not change either, so.
Is that being done because of the overall board being downsized?
Because went from 21 to 15 members, most committees have at least 7 members on them. 7 members is almost the majority of the board now, so obviously the committees, the sizes of the committees can and should be reduced, consistent with the reduction in size of the board. And then we have, I believe, 5 or 6 standing committees on the board. If you assign, even if you reduce the size of the committees down to 5 people, if you have 5 or 6 committees, you're gonna have a lot of people doubling up and.
You got one individual on 3 or 4 committees.
Exactly. And there's always the 80-20 rule in play to begin with. So it's just trying to efficiently and most productively use the time of our board members.
Makes sense.
And then the only other thing I had was Karen Shiflett, our Director of WIC and Family Case Management, asked if she could make a comment. You had asked if supervisors had any input about the retention policy, and she wanted to know if she might be able to make a comment.
Sure.
Karen, come on.
Okay, thank you, sorry. As you guys, some of you may know, I've been here 28 years and 17 of them as the WIC Family Case Management Division Manager. And I have heard endless comments about the importance of a monetary type of compensation for staffing. And so I would just respectfully ask you to consider looking at possibly building into your plan a reward system for years of service, to consider the 1 to 5 year employees, not just the 5 year and up, because we are retaining some employees for maybe a year, maybe a year and a half, sometimes 2 years, and then they're tending to move on. So I just think it could be potentially beneficial to try to acknowledge the ones that at least have made it through a year. And I just wanted to ask a moment of your time to think that one through for us. Thank you.
Thanks.
Thank you. That's all.
Okay, presentation and acceptance of financial report.
Okay, I'm going over this evening. I'm sure you asked me to let you know she is at her daughter's Christmas program. So the first one I'll go over is the one that would be in your November packet, since you didn't have a chance to approve that one yet. At that point, it was as of 10/31/22, 92% of the year had passed, and the ending fund balance was at $7.7 million. Sheree did make a note that she is still working with the auditor's office to update the accounts receivable. The total revenue on that back page was at $7.6 million, and the total expenditures was at $6.1 million. Some of what you see there is that the October resolutions that you voted on were not on the budget yet because they did not get approved by the full county board until the November meeting. Do you want to vote on that now or go ahead with the December?
Yeah, give me a minute, because I haven't got to it yet.
Oh, okay, sorry.
I didn't realize how big in the packet, so. Yeah.
You have one financial report in each of your packets.
Okay. So any questions on this one for October?
Yes. The question I had was the same question as a carryover. I think we talked about it before. Under the emergency preparedness, we saw that that is 252% of, it's at 252% of its budget. And we were gonna find out why it's so far ahead. We budgeted
Yeah,
only $97,115 and we've spent $244,756.
So what I have from her is that does not include any of the resolutions that would include some of that additional grant funding that we had. So that's why it would appear as if it was overspent. They'll get something very specific from her in writing and have her send it to you. And if all the board members want, I can send it to all of you. But my understanding is that does not include all of the resolutions, that they have not all been entered yet because they have not been approved at the county board level yet.
So it's gonna come down when that gets,
It will, so the revenue will go up.
will go up.
Yes, because of the
Okay.
grant funding
I
that
got you.
was not yet reflected there for
Okay.
things that we would have got additional dollars for.
yeah, if you look at November's statement, it jumps up significantly.
So that's the ratio.
That makes more sense, maybe.
More.
No,
Right, because of that, I think it's so much money.
and this in relation to what it is to say to more text input, there was through it. You got that note.
Oh, I see, Mark, that's wonderful.
But yeah, but that goes way over the other,
Yeah, it
it
goes the
swings the
other
other
way.
way, way out of whack.
We also have, we had not yet, as of November 30th, we had not yet received any payments for the FEP grant, which is the Public Health Emergency Preparedness, for FY '23. We didn't start submitting reports until October when the contract was signed, but we are owed for July through October. So that will also edit that a little bit. And then,
Okay, thank you.
Okay, so do we want to,
Make a motion to approve.
we want to approve that one first and then we'll get the current one, that's the right way to do. So we're gonna make a motion to accept the financial report
Second.
for October.
Mark Strand,
Yes,
Jeff Antler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jerger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
and then we also have expenditures that we need to approve from last month as well. We need to do that before we jump to the other one. So while you're in the packet for October information, we have the vouchers in there for expenditures. Anybody have any questions on any of the items in that? If not, make a motion to approve.
So moved.
Second.
Which one? Did you do that after Jerger?
Yes.
Mark Scranton,
Yes,
Jeff Antler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
now we will jump back into presentation, acceptance of the November financial report.
all right, so that was as of the November 30th, 2022, which is the end of the county fiscal year, so 100% of the year had passed. You will see on there the ending fund balance being at 7.3 million. Another thing she wanted me to note, a couple of things. She is working, as I mentioned, with the previous report with the auditor's office on the accounts receivable to get that number adjusted. And then also the number that you see, the 7.3 million, that's not completely final, even though that is the end of the fiscal year. The numbers are not finalized yet because they won't be until the auditors have come year-end numbers are finalized and all year-end adjustments are completed. So you won't have that number for some months, but that's basically the estimate this time. And then on the back page, you will see total revenue, 7.9 million. You'll see that is at 101.7%. But one of the resolutions you voted on tonight will adjust that so that it is under the 100% mark. And then total expenditure, 6.6 million.
So, to follow Carolyn's question on emergency preparedness, we went from a big imbalance in October to this in November. So this is showing now that we have a budget of 700,000 for the year. So we've only spent 36% of it. So how do we go from 700,000 in our budget in November, and the previous month was only 97,000? That can't all be grant changes, can it?
That is reflected from those resolutions from.
Oh, really? Is that
Yes.
much? Okay.
It looks like there's $900,000. It's only 5 years.
So we've got that much grant money and we've only spent 36% of it for the whole year.
That would be, so for specifically in the emergency preparedness line, and that was where we talked about if we don't spend all of the grant, then we don't get all of the funding reimbursed. So it's not something that we would have basically sitting in a pot afterwards if it is grant funding. But yes, there are some grants, some of the more COVID-specific grants that we are underspent on, or we haven't had as many expenses as we thought that we would.
Will that money have to go back?
We don't.
Receive it?
Because it's reimbursement based, we don't have it all. We get, percentage paid at the very beginning, and then the rest of it is reimbursement based when we turn in our reimbursement certification at the end of each quarter with that report.
So the revenue's only recognized when you get for actually you're supposed to get, not the whole.
Correct, yes.
So we've got almost $500,000 sitting there. Where is this going to come into debit or credit or refund, or what's going to change with that?
No, it won't be a refund. So if we budgeted that we were going to have $500,000 that we would be spending, for example, and we only spent 200,000, then we wouldn't ask the state to reimburse us for the other 300,000.
You don't get the money ahead of time.
We usually get a small percent.
But you get the whole
Right, like
thing.
25% when you sign the grant
Yeah.
and execute it, and then the rest will be reimbursement. Yes.
So this is just a figure on paper
Just a
then?
budget.
Okay, all right.
I have a question though, and hopefully it relates to this, I think it does. Where are we at on investing that money?
We put it in a money market.
It is in there now? Oh,
That's
okay,
what the treasurer did. That's what we directed him to do.
okay. Well, I thought so.
Unless we want to do something more aggressive, and then that's another discussion we have to have. That's an action item.
No, I just,
My memory was it was pretty conservative what they did.
Yeah, but the rates are going up on everything.
Yeah, they got-
So
yeah,
it'll continue to climb on its own
okay,
based on what the bank does with the market.
perfect.
And that's basically,
Can we start
Next,
getting
totally safe.
statements about how much interest then?
yeah, we probably won't see anything significant on that. What do you think, Jeff, for at least 90 days before you're going to see anything to really talk about?
Right.
Because over the course of the year, we were talking potentially $120,000, $150,000 based on the current rate. So until it gets in there for a while, you're not going to see anything. to
But we'll
really
start seeing it
talk
on here,
about.
it'll be reported to us when,
I honestly do not know,
Yeah.
because I haven't
yeah.
been in that conversation, so I don't know what they're
Mike,
going to
how
give
would
to
that,
us.
how would that work? And that we request some kind of a monthly update from the treasurer, what the health fund balance is with the interest off that account, or how would we want to proceed getting that information?
Make the request, give them enough time to prepare the report, because they'll have to reach out to the bank and obtain it, but, it's just a matter of making the request and getting them to do it.
I don't, unless anybody feels real strong about it, I don't really feel a need to add more stuff to the treasurer's plate, but maybe we ask him to give us a quarterly report.
That'd be great.
I think it'd be sufficient. What does everybody else think? I think we get a quarterly report, just kind of keep our eye on the ball and see where we're going. And at some point, we may say, hey, we want to take some of this and do something a little bit more aggressive with some other vehicles that we can get a little bit better return on our money, because it is a lot of money, especially when we're talking about maybe doing some other programs here.
Right,
That right there could more than fund that.
Make me feel comfortable,
Yeah.
that, yeah.
Are we allowed to break it up into quarters? As in two, or half and half, but half of it a little more aggressive, half of it in the
We
money
can do whatever
market?
we want.
Can we?
That's what the treasurer said, yeah.
Okay.
They got some stuff in some different funds. I know, one individual I talked to, he said you can get into some treasury notes that cycle through, but his recommendation was, he said, take a percentage of the money and drop it so much per month over a period of time. That way, when you have put so much in, what your last deposit's gonna be, the first one will be coming out. And that way, it's still pretty fluid. There's not a lot of hindrances with taking that money out if we needed to, but it gives us something that is pretty much no minimal risk there with that. But then that way we have a little bit of flexibility, but we definitely get a lot higher return on it for sure. So they got some programs, a lot of that's gonna be done through some programs that the state's got set up that are kind of predetermined on what governmental bodies could do with tax money, how they can utilize it from an investment standpoint. So there are some guidelines and restrictions in order to be able to do that, but we do have some other options. And we can ask them to come, to one of the meetings and explain some of that a little more in detail, might be beneficial for everybody. So I'll talk to him and see, maybe we want to get him there like January, February, and enlighten us a little bit.
Yeah.
Because it's good to know.
That is.
Okay. All right, now we have to do review, approval of department expenditures for this month.
We need to vote on it. We need to vote on that report.
Yeah.
Oh, sorry, I thought we already had. My mistake, we got sidetracked. Okay, make a motion to approve the financial report as presented to November.
I made that motion.
Second.
Sorry, I didn't hear who seconded.
Dr. Sugar did,
Thank you. Jeff, Mark Stratton,
yes.
Jeff Bentler.
Yes.
Kenny Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
Okay, review and approval of department expenditures. Anything of importance we need to know on this for November granting at all?
I don't think so.
Okay. Need a motion to approve as presented?
Mark Stratton,
Yes.
Jeff Bentler,
Yes.
Kenny Clevenger,
Yes.
Carolyn Wagner,
Yes.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
Okay, do we,
I do want to go backwards a second. I had a note on here, something minor, but why do we show an expenditure of, it says client bug treatment for working?
That would be through one of our programs that provides that assistance to clients for issues that they're having. It would have been somebody that had a pest control
So
problem.
it's residents, right? Yeah, okay. That's kind of what I
Okay.
figured.
do we have any other grant applications to review? Okay. All right, department division reports. Do you want to go anything over your administrative report at all?
Nothing that I
Can't
have
speak.
specifically.
Okay. Then we will give Ms. Wade the floor to do her presentation.
All right. Well, for those that are new, my name is Kathy Wade. I've been at the health department for a little over 18 years now. I do have what is called an REHS RS, which is an environmental health, or registered environmental health specialist, registered specialist sanitation through NEHA, which is the National Environmental Health Association. It is a nationally recognized certificate throughout the US. And then I also hold my LEHP, which is a licensed environmental health practitioner through the state of Illinois. That's only an Illinois state license. So for both of these, there's a lot of knowledge that's needed on all types of different environmental health programs, from swimming pools to sick buildings to pest control to food safety to septic to you name it. So I do help hold all of those licenses and certifications. I wasn't going to talk about our core programs because I think our core programs, food, well, and septic, we talk about those quite a bit throughout the year. So I wanted to draw your attention to our other programs that don't necessarily get as much highlights, I guess would be the word to say. So those would be our tanning facilities. So we do have 6 facilities still in Macon County that do have tanning beds for a service. So I used to say for a fee, they needed to be licensed, but now I have an apartment building who has a tanning bed for their tenants. So I do go out and do those inspections. They get inspected once a year. Things that we're looking for is paperwork to make sure that they're not tanning at that facility more than once in 24 hours. We do have a few ladies in Macon County that are addicted to tanning beds, and they will go to 3 or 4 different facilities within one day. I can't stop them from going to a different facility. By the way that the state code is written, I can just say you can only tan at this facility one time within 24 hours. I'm looking to make sure that they're using sanitizer. When I first started, we had a gym that had tanning beds for their clients. And they were just spraying them down with water, and then we had a huge outbreak of ringworm, so that was a fun one to do. So sanitizer, I wear bulbs. Again, when I first started, we had an individual who had a big sign out there that said, medical grade bulbs, tanning is safe. And what he had done was go get bulbs that were used for like eczema treatment and put those in all of his tanning beds, and everything was safe. So I embargoed all of those beds. So that's our tanning program. Body art, we currently have.
I'm so sorry.
You're fine. We currently have 20 facilities with approximately 47 artists here in Macon County. We do have one new facility that is waiting. She's not quite ready to open, so we'll be adding one more starting in January. They get 2 inspections per year. The easiest is there's a state inspection and a county inspection. The state inspection licenses the entire establishment. The county licenses the artist. And where that comes into play is if you think of most of our shops, they have multiple artists going on. If there was a MRSA outbreak, for example, in that facility, if it was only the state license, the state would say close the entire facility down. However, with Macon County, the way that our ordinance is in Macon County is that I can pull just the one artist who may be in question. I can pull his license, let's look at his records, let's look at his equipment, those types of things, and allow this shop to remain open for the other artists. So it's kind of a blessing for the other artists. However, I still do have the control locally that if I feel that it's more than just one artist, to say, let's just close everything down and let's look at everything as a group instead of individually with the artists. So they get 2 inspections per year. Things we're looking at, equipment, supplies, most of them are going cordless now, so I don't have to worry about the tubes and the sanitizer, the autoclave, spore test results. Again, sanitizer with that, and of course, also paperwork, making sure that they're old enough. With body art is also piercing. So we have some places that don't do any tattoos, but they do piercings, body piercings. I also handle complaints. We have a complaint right now on a facility that should not be piercing noses and up in the cartilage. They don't have a license, but they're doing that. We're seeing a lot of high infection rates, so you have to go out and handle that one. And then we have a lot of microbladers now, and those are the tattoos. So that seems to be extremely popular, but the tattooed eyebrows. So we have lots of just maybe one person in a shop doing microblading. I think we're gonna start seeing some new techniques coming out possibly. And I'm really hoping that between IDPH and Illinois Department of Professional Regs, they put a little bit of a hold on some of them so that you have to be a licensed doctor to do some of them. So that's body art. Vector control, that's something that Rachel and I do together. I am a licensed pesticide applicator in the state of Illinois through IDOA per this grant. So this used to be called the West Nile virus control grant. Now it's a vector, so we still do our bird collection, we still do all of the education with the mosquitoes, we still contract with making mosquito abatement, but now we also do like bed bug complaints. We, of course, don't have the funding to go out and handle them, but we try and do our best to educate. We work with other agencies within Macon County, where prior to COVID, we had what was called the BBC, the Bed Bug Committee. That involved the city of Decatur, Decatur Transit, Decatur Housing Authority, the daycares, because bed bugs, and they still are, they're a huge problem in Macon County. IDPH says that because bed bugs do not transmit disease, there's no funding for them. So we have individuals that are living in their own homes and their own apartments that they don't have the funds to treat bed bugs. And it really is heartbreaking when you hear the stories and the people calling in and they tell you, I can't even sleep at night because I'm afraid to shut the lights off. They're gonna come out, they're gonna get me. Or you see their kids come in with bites just from head to toe with them. So we do our best to do as much education as we can and try and refer them to different agencies to possibly try and get some assistance. But that, the vector is a lot of education than anything. And then we still do smoke-free Illinois. So every restaurant inspection, every inspection that we do, whether it's a body art retaining, a restaurant inspection, we record whether or not we see somebody smoking, see an ashtray, see signs of smoking. We cannot go off of the smell of smoke. We learned that a long time ago when it first started. So if on, let's say, a restaurant inspection, they notice an ashtray filled with cigarettes, or they notice somebody physically smoking, they write it on the inspection form. They go over that during the exit interview. When I get the report and I review it, I then issue a citation. So the first one, of course, is $250. As you guys can see in my board report, we've had one open citation, I think, since 2016. The person has requested a hearing and the state's never given us a hearing date. So Marissa and I work on Smoke-Free Illinois, and we ask all the time on that about, hey, what are we doing with this one? And there's never an answer. So those are the basic programs that we do, besides our core, which is food, well, septic, and closed as well, for environmental health. Emergency prep, I've kind of already talked about that one when we talked about the resolution. One of the basic things that we want to do, of course, is not only bring CERT back, but also increase our MRC group, which is Medical Reserve Corps. We saw a huge surge in that when pandemic first started of student nurses or retired doctors really wanted to come in. We'll help with the large vaccine clinics. We used our student nurses quite a bit during our vaccine clinics. We saw a huge surge because when a pandemic, the community wants to help and they want to be there and they want to be part of, what happened. And I was part of this. I helped, vaccinate X amount of people. But now that the pandemic's gone down, our numbers are going down. It's very hard to keep volunteers engaged and keep them interested and keep them coming back when at this point, I don't have the time to bring in specific trainings for them to where they want to stay with us. So whether it's something like bringing the Red Cross in to do CPR training, recently we've just done this, did the shelter fundamental class with all of our staff through the Red Cross. So they kind of know more about sheltering in place now and how to set that stuff up. The ability to be able to do that more within a full-time emergency prep coordinator is going to be huge, and I really hope that will bring in some more MRC and keep those active. Also bringing in more community partners, because I think we need to get out there in the community and let them know exactly what we're doing. And that's one thing I hope that the new hire will be able to really do. So that's both of them in a nutshell, as quickly as I can. Yes.
May I ask a question?
No, you may not. No.
Please. I've recently become aware that some salons, and I'm not saying here in Decatur, but some salons, spa type of salons in central Illinois are doing something called Quench IV, and they're actually administering IV drips.
That is correct,
Are
Rachel.
you dealing with that?
I've heard this, it blew my mind. What in the world? We know more about, all we've done is Google it. I mean, we've not seen,
So
It's happening in Texas. I just had a grandchild get one of those IVs.
yeah, so you just basically go into like a Starbucks coffee and say, hey, I ran a marathon yesterday and I need, some extra electrolytes, and boom, they put an IV in you and you
like
just
banana
go.
bagging people.
Yeah, it's a pretty,
Yeah.
you
Cheers.
can select, I like Dr. Jones's rejuvenation blend. I'll have that, please.
Yeah,
It's horrible.
so luckily that stopped me. But
Well, who is it?
so it falls under Illinois Department of Professional Regulations, and we saw that for one of the businesses that came into town. We were looking at some of their other locations in central Illinois, and I went over to Rachel. I'm like, Rachel, this is not going to happen in Macon County. So luckily, we know that this one is not doing it here. But I did reach out to Illinois Department of Professional Regs, and it's kind of the way that they explained to me, it's the same as anybody that is a phlebotomist, that they can just basically, go to certain training, and that's all that they have to worry about.
So IDPR has no problem with this.
from when I contacted them. How long ago was that?
It's been a couple of months. It doesn't make sense though, because I mean,
Horrifying.
you don't have a pharmacist on site, you don't have, you still have to have a physician order.
Oh,
I mean, we can't even give a flush without a
Not
physician's order,
only
so,
that, you could have somebody in there with cardiomyopathy
yeah.
and throw them completely
Oh,
into
yeah.
congestive heart failure. I mean, it's horrifying.
Yeah, and they're adding to the heart problems.
Yeah, imagine if they already had a high potassium rate and we banana bagged
So
them,
all
what
we're
happens
gonna have,
then?
all we can do is just keep our eyes and ears open, is that what we're hearing?
Yes, and what I will say, kind of with some of the previous complaints that we get when it comes to not our jurisdiction, but more of a Department of Professional Regs, is as soon as I can get enough detailed information to be able to send a complaint over there, I do. And they are fabulous about responding back to complaints within, I'm gonna say within a week. I don't think I've ever had one that's been super, 6 months out going, hey, I just wanted to follow up on this. They do really good at
But if
that.
I have a problem with the concept that they are even okay with allowing this, I would just go and call them and do a general concern.
I would think so, yeah.
Absolutely.
This is horrible.
Yeah, I mean, I look at it as,
They're
like
getting
you
their
you
hands
have a
on
license
supplies
for
from
dentistry
somewhere.
and you have a license for nursing.
Supplies to start with.
Nobody has any licensing for this.
Amazon.
so-
I was gonna say probably anywhere,
Yeah, what's in their bags? Who looking through what's in their bags?
Yeah.
Oh,
Yeah.
yeah,
Yeah, I mean, it's just kind of like, we call in the body art world, we call those that are tattoo artists at home, we call them scratchers. And they're like, oh, where do they get their equipment? You can go to Amazon and order
apparently they're also
everything.
giving Botox injections
Yep.
at these places too.
And they give you oxygen.
That'll be
Oh,
the
mine
next,
was
that'll be the next
Mine
wave.
was
Yeah.
Majorities, they'll be slamming clinch down IVs.
That's so funny.
Yeah, so yeah,
What's the term again?
I say luckily
What
it's
it
not
is?
my jurisdiction, but we've been brought into this again.
$140 for a Myers Quench IV cocktail.
Where's that at?
Where's that at?
It's at this quenchivspa.com.
God.
So you can buy it as a complete kit.
And just so you know, if you send me out on a complaint like that, I'm gonna be on the floor, so we need to send Rachel.
I don't know what I'm going to do.
I
I'm
don't
gonna tell
know.
everyone I can, because no. So,
We'll send both of us and she'll just, prop me up in the wall or
yeah.
something.
Kathy loves needles, they're her favorite.
I know some general
Yay.
surgeons that do that and have IV places where they'll give IV fluid,
I think I would trust a general surgeon though.
Yeah. something that's not being
Not an esthetician
supervised by
or,
a physician.
yeah, or a
Not
cosmetologist.
Yeah,
I mean, jeez.
yeah, I mean, I've never heard of that, that's.
I couldn't believe
I don't
it.
think that's just
That's
a human loss.
And it's unfortunately becoming.
But if
more common.
IDPR says, well, as long as they're phlebotomy trained,
Yeah, but if somebody, like
They're
you say, you give them the wrong concoction and.
or you give it
they-
too fast, you give too many fluids over a short period of time.
But phlebotomy trained is just sticking them with the needle, not
Yeah.
doing any of the rest of that. Yeah, it's,
Exactly, now
it's
administrating
craziness,
something.
yeah.
Okay.
So we
That's
do
on
not
my list,
support that,
IDPR.
just so you know.
Okay, back on the tracks again. I have two things for you. Number one, I wanted you to give us a real quick update where you're at with your electronic record keeping. Are you 100% on board with that? Is it still in progress?
We are doing great. The actual digital company is doing great. It is the financial software that we use here at the health department that we've been on a hold for, I can't tell you how many weeks. And unfortunately, today we were supposed to have a meeting with them, but we had no internet or phone, so we couldn't have a meeting with them. The problem is the all paid system, which is what we use for like credit card payments. They didn't want to give the digital system the authority to integrate it into there, even though it was a long story. Currently, we have paperwork over at the treasurer's office for them to fill out, giving us the approval on our side for them to do this.
So is that for businesses that want to pay with a credit card instead of a check?
Yeah, so let's say we go out and we issue a priority violation. And we have to go back and there's a $75 fee for us to go back. That facility would be able to go to our website and pay that invoice right then and there with a credit card. And then it's taken care of already. Where it's really concerning is when it comes to the reopening fee for any closure, because there's a $250 fee. So let's say we close them on a Friday afternoon and they want to reopen on a Saturday, well, we don't take money in the field, we don't take cash in the field, we don't take checks in the field, and we're not gonna take it on a Saturday when we have to hold on to it and become liable for it until Monday. So having the ability for them to go online automatically and pay right then and there, and then it will shoot an email to me or to Sheree or to whomever we decide going, yeah, Mark Scranton has paid that, and then we can continue with that process.
Okay.
I did also have another conversation with them. We are meeting weekly, every Thursday we meet. And then our goal is to go live in January. That is our
Okay.
goal.
And on the very front of your report for this last month, you make reference to a salmonella investigation, and you go through this whole thing by counties, findings and everything else, and you get down to Macon County. Kind of explain a little bit what 34 close contacts means, because it says, I see a local establishment
So
in parentheses here.
a local establishment was implicated. Two of the cases that were here in Macon County report eating at this local establishment the exact same day. So we went out, we did a full review of policies, of not only their sick policy, thinking that maybe an employee was sick and brought it in and then transferred it, of course, or was it actually a product that they received a bad product? So the facility in question was absolutely wonderful to work with, and especially for the large number that we were talking about when we started looking at employees. So the close contacts were individuals that worked on the specific day that the two cases confirmed being there. Every single one of those people had to produce 2 negative stool samples for salmonella. Part of our problem was that some of these individuals were still symptomatic, some were not. So if you were symptomatic, we said, okay, you can't even go to work until we get the 2 negative samples. Those that were not symptomatic, they were allowed to work while they were providing those negative stool samples. IDPH limited us on the number of stool samples that they would accept from us. And then that facility or that establishment had to find someplace locally to do all of this testing on a short turnaround time. But ultimately, I think close to 100 employees, 7,500 employees were called and interviews were done. So kudos to every staff member in this building who made phone calls for interviewing. Because it took all of environmental, we had some nursing, we had some WIC, we had anybody that had a phone, guess what? Here's a piece of paper, start calling and asking questions. Because we had a very short turnaround time to get all of these people called and interviews done.
So it wasn't a lot throughout the rest of the state, but we had a lot here. So, I mean, did you determine it was an individual or was it a food product that caused it?
CDC closed it.
Okay.
I don't
So
know. I
you
mean,
really
really,
don't-
that's about all they said was
You really
CDC
don't
closed
have
it, so IDPH said, okay, we'll
Yeah,
close it
the way
too.
that they were going about it though, it looked like it was food related because it being in different communities.
Right,
But, I mean, I can't tell you that for
but they
sure.
didn't trace it back to anything specific.
No, there
No.
wasn't like one specific lot number on a product that did that.
No, and then even if you look at the facilities that were in question, I mean, it's pretty much any place that sold hamburger or chicken. So you
It was
can,
really widespread.
you can imagine.
Hmm.
It was just, I don't think that they could actually pinpoint the exact cause of this one. And it was a pretty specific genus and species of salmonella. So it wasn't just like a symbol, it was just E. coli, it wasn't something like that, so. It was a lot of man hours.
That's all I had. Anybody else got anything for Kathy? Okay, thanks for your time.
Thank you.
Okay. Last thing, since you had already gone over that presentation, employee recognition, you'll find your packet, we have several individuals that have December anniversaries, talk about anniversaries tonight. And thank them for their years of service. And that being said, if anybody has anything else, then motion we adjourn.
We have a question. Are we allowed to go out the new doors now, or are they locked?
You can go out them still.
Okay. Okay. We just got thinking about that. We've been questioning that back here for a while.
Yep, you're good to go out. Maybe you didn't notice we painted our sliding doors out several years ago, they got on the budget, kid, their dog. It's a lot easier for the parents.
Thank you.
Thanks for being here.
Okay, we adjourn.
Thank you all for listening.
Mark, is there what, 90 minutes?
Basically, replace everything.
It was like-
Keep that.